So, as I've already mentioned, it's really difficult as an interpreter to be an expert in all specialisms. You know, doctors are experts in their fields. They're not necessarily an expert in all things medical, and they certainly wouldn't expect them to be an expert in the DWP and education and social services and mental health as well. There's just too much information. So there's no such thing as an interpreter that can interpret absolutely everything, because each setting is already very complex. As I say, there's many different subsettings under all these different specialisms. So again, think of medical, it's not just one subject, there are lots of sub areas and specialisms. And because of that, these can be quite linguistically demanding, because the assignments with them vary. As I say, mental health or health have so many different departments or conditions or procedures that even interpreters that have got 20 years of experience doesn't necessarily mean that they don't need to do preparation or research prior to any assignment that they're doing. So that's why, as I mentioned in the last section there, all interpreters need to continue CPD so that you can continue working. And every time you get an assignment, if you know what the subject is beforehand, you'd be recommended to look back at your glossary or to make a new glossary if it's a new area, to revise that to make sure nothing's changed. I mean, even with the glossary, don't completely rely on that. You might want to do some checking to see if anything's changed recently. So when we talk about a range of interpreting assignment, it means being able to see the difference between different assignments that you're given, even though they belong to the same public sector. So, for example, being able to understand that even though you've got a health assignment, it's not necessarily going to be exactly the same as the last health assignment you did. So it's being aware of that so that you can prepare yourselves accordingly. And I'll give you an example of something that might be very different in terms of terminology or interpreting approaches. So think about mental health settings, for example, which is a level 3 specialism. It's something that once you've got your certificate, you'll be able to provide a service in. So there's some very, very different appointment types within that setting. So, for example, you might one day be asked to take part in a family therapy session. And then another day, you might have an appointment interpreting during an intake review, which is where the doctor finds out about the patient's medical and psychological history. So even though both assignments are about mental health, they'll look very different, and they'll require yourself as an interpreter not only to use different terminology, but also to use a different approach to interpreting. So again, imagine those two different situations. A family therapy session, you'd expect a more general sort of vocabulary. So it's not going to be technical. It's not going to be particularly medical, because there's lots of people there who are not necessarily involved deeply with that particular case. You might actually need to use a little bit of simultaneous interpreting. So, for example, in mental health, if a family member is sharing their feelings and thoughts or telling a story or sharing an experience, sometimes the practitioner won't want you to interrupt them or to ask them to split their speech into smaller sections, because it affects how they would talk about that intimate moment. So they might ask you to do some simultaneous interpreting. Whereas on the other hand, an intake interview is going to be quite procedural. There's going to be technical vocabulary. There's going to be questions about specific conditions, medications and symptoms. And generally that would be consecutive interpreting, because they would ask a question and then they would get a response, and then you'd interpret the response, then another question, you'd interpret the question, and so on and so forth. So even in that one area, it can be quite different interpreting approaches. Okay, so that's really all there is in that section. It's a very short section there, the range of assignments, and it sounds obvious really, and I'm sure that you all realise that even with this, within the same specialism, you're going to get some very, very different appointments. Think about DWP, just because you've gone to the job centre doesn't necessarily mean it's going to be talking about one type of benefit. It could be a range of different benefits and conditions. So as I say, I'm sure that's pretty obvious.